Hi there, my name is Dr. Christina Rahm, and I'm the chairman of the International Science Nutrition Society and the founder and president of Rahm Thomas University. Today, I want to talk about a case study that was conducted by the International Science Nutrition Society. This case study had to do with stroke and cardiovascular disease. The patient was treated by a doctor named Dr. Norbert Keskes, who's in Hungary and treats a lot of Olympic athletes as well as professional athletes. The particular patient had a long history of cardiovascular events, even though he was an athlete. Dr. Norbert Keskes was able to use different proprietary blends to really assist this patient along with traditional medication. The patient was experiencing numbness in the arms and the legs and continuous issues with heart palpitations, as well as stress and hyperventilation, as well as the patient having high levels of blood pressure. Dr. Keskes used 1 drop of clean slate in the morning and 1 drop at night. This was changed to a proprietary blend so that the patient did not know what they were being treated with. The proprietary blend was a silica trace mineral and a vitamin C blend that, again, was 1 drop in the morning and 1 drop at night, increased to 10 drops in the morning and 10 drops at night over a month period. Additionally, the patient used 1 tablet of a formula that had to do with L-theanine, pine bark, and velvet bean in the morning. Due to the cardiovascular and stroke events, the patient had experienced a lot of fatigue, and the doctor felt like this would help the patient with the fatigue as well as some of the other issues the patient was having. The third proprietary blend that was used was a blend of turmeric, curcumin, resveratrol, raspberry, apple cider vinegar, and some other ingredients that the patient used 1 sachet in the morning and 1 sachet in the afternoon. Dr. Keskes was able to notice that this patient did significantly better over the first week and even further better over a 4-week period. The CRP testing decreased with inflammation, and the patient was able to feel significantly better and to lose the numbness in the hands and in the feet. All testing was done with urine secretion, looking at how the patient and the symptoms were alleviated through these natural treatments in support of also the traditional treatments. In the doctor's conclusion, this was a successful treatment because on all parameters, it was a 20 to 40% improvement in scale ratings. We look at this at the International Science Nutrition Society as a breakthrough that could potentially help other patients after further research.